Joining us now, though, is Sean Connaughton. Sean is the CEO, President and CEO, Sean, the President and Chief Executive Officer of the Virginia Hospital and Healthcare Association, and he's an FOJ, friend of John. We've known Sean a long time. Great guy, and he's done a super job with VHHA, and he is with us now. Sean, we're live in New Hampshire. Thanks for being with us.
Hey, good morning, John. Long time no speak, and now I understand why you've gone national.
Well, that's because Al feeds me his finest meats and cheeses here, and Al owns he brings all this stuff in and he says, well, I own a food company, and this is what we supply Giant with in Virginia. So I'm like, okay, I'm eating Al's prosciutto. So life is good here for us, Sean, at Al headquarters. But
hopefully it's cooler, too.
A little bit, right? 70 degrees here, not the 90 it's been in Richmond. Sean, thanks for being with us. I really wanted to get you on today because there's a new poll that came out that shows that Virginians strongly support Medicaid expansion. Also, they view hospitals favorably, and they believe that COPN should be maintained. Now, I wanted to get you on today to pat us on the back because, as you know, I was the strongest Republican conservative advocate of Medicaid expansion during the last cycle, saying that it would benefit Trump voters, that it would benefit Virginians, that it would benefit hard-working Virginians. And I got a lot of flack for that. I lost a lot of listeners over it. But look, now we get a poll that comes out, and Virginians are now in favor of it, Sean, by big numbers. I was hoping you could elaborate on that.
Yeah, John, this poll that we did is actually a follow-on to polls that we started doing a couple of years ago. And we're going to do this annually so we can start to track trends and see whether we're seeing things move up or down on some basic questions. And then we're also asking some topical questions as well. And this poll shows exactly what you were saying and we were saying for all these years that we debated Medicaid expansion in Virginia, is that when it comes to a bread and butter issue like this, people overwhelmingly support there being some sort of coverage for individuals, particularly those who are in our minds, and we can actually go back and look at some of these numbers based on some of the people that are, so far, the people that have actually signed up for expansion. A great deal of them are already working. These are people who are in, low wage or in essentially part-time jobs that cannot afford health care and health insurance. And this was a great opportunity to provide those people with coverage. And also, when you look at where they're signing up, great. If you want to go back to some basic politics, red and blue, enormous numbers of people in red areas have signed up for this. This is what we've been saying and pointing to. These are the people who are out there working every day in low-wage jobs or in part-time jobs with families, and providing them the opportunity to get some of the health care that they need is positive for them, and it's positive for us in the long term, because I'm telling you right now, we all pay those costs when those people come in to an ER for very basic care. And as you know from some of our previous conversations, under federal law, somebody walks in the ER, we treat them. Right. And we're going to do that anyway, but the issue is that by law, we've already turned health care into a right years ago. And so what would you rather do? Have somebody walking in with a minor injury or a cold going into an ER, or going to a primary care doctor which is a much more suitable place to get their care? So we're very excited about this. This continues to show that the polls that we did back over the last couple of years, particularly one before the General Assembly did take action on the Medicaid expansion, shows very clearly that these were not blips, that these were, were then and continue to be very strong support for Medicaid expansion. And for the General Assembly and us in Virginia to deal with some of these issues on health care generally.
Well, look, the bottom line is the vision of going to Medicaid expansion has now proven out. The results are there. The poll numbers are there. You're on the John Fredericks Radio Network. We're with Sean Connaughton. Sean is the president and chief executive officer, CEO of the VHHA, that is the Virginia Hospital and Healthcare Association. And just some key takeaways here, Sean, that I want to reiterate. Number one, this has only been in place for 7 months, right? Because it got passed in the last General Assembly, had to get implemented. So after 7 months, the program is working exactly like we said it was. About 300,000 people have signed up. That's exactly what we said the number was. We said it was somewhere between 300,000 and 400,000. 300,000 people have signed up. But not to get to the politics of it, Sean, but I do have to emphasize this. The overwhelming majority of these 300,000 people who have signed up are working Virginians in rural areas who voted for Trump. These are Trump voters who are trying to get ahead. And Sean, here's the thing. They don't want to be on Medicaid expansion forever. They want to be on it as they transition out in the Trump economy, Sean, to a better job so that they can afford their own insurance and get off it. They don't want to stay at this level. This is a transitionary stage, and this is why this was absolutely the right thing to do. And I commend you guys for doing it. Also, what a lot of people don't know is hospitals in Virginia have stepped up to the plate, and they're going to pay 10% of the cost of this after the 100% federal reimbursement goes down to 90%. I think hospitals are going to pay a pretty big percentage of that. I don't remember the exact number. How much is it? 10% or so?
Yeah, it's 10%. We're paying the entire amount, John, and we did that to get the political ball, moving
right
on this whole issue, because unfortunately that was being held up as one of the reasons why they could not do expansion. So the hospitals, and when I say the hospitals, I'm talking about 69 hospitals in this state volunteered to put the money forward for the 10% match, which, by the way, is around $300 million a year when the program is fully implemented. They volunteered to put that money forward so that we could end up moving forward on this critical program. And we only end up seeing hospitals and health systems are only probably seeing about a third of the money coming in from the patients. The rest of that money are going to primary care doctors, they're going to pharmaceutical companies, they're going to medical device manufacturers, home health care, things like that. And so most people don't realize that the hospitals came forward, and essentially we really went out on a limb to get the politicians to get behind this program and finally pass it. And we are only a minority, quote unquote, beneficiary of it. So people can't turn around and say, "Oh, you did this because it's in your own self-interest." For every dollar that we're putting in, I mean, we're only getting, quote unquote, about 30 to 35% of the money coming back overall from this program. And we want people to realize that sometimes, in politics, we're off to the next shiny object, the next controversy, and we were trying to make sure we understood whether people understood that we voluntarily put this forward, and if they didn't, to sort of understand then, who do they think is paying for it. And so these poll numbers do very clearly show that most people don't realize we did it. And actually most people don't think it's fair that it's only the hospitals doing it. They think the insurance companies, the pharmaceutical companies, those who are making money off of this and not have no skin in the game, that they should have some skin in the game as well.
Sure, and just to put this in perspective again for our listeners, because we have a lot of hyperbole that goes on in the show about expanding Obamacare, and one of my friends, Chris Peace, got defeated over this issue in standing tall and voting for it. Though, just so our listeners understand why we fought for this, and the poll numbers are showing it out, are playing it out. The federal government is reimbursing 100% of the costs back to states. 100% of the costs back to states through I think what 20 is it 2020 or 2021? Sean?
Till next year. That's right, till 20.
Okay.
So it actually went. It was 100% originally, and it gradually went down. I think it's down to 92, 93% this year,
Right.
and then next year it's a 90-10 split, and that will continue out into the future.
So when it gets to 90-10, okay, when it gets to 90-10, it's goes on a greatest scale. When it gets to 90-10, just to put this in perspective, so the 69 hospitals in Virginia. And I've got a representative here from New Hampshire that I'm glad that he's dialed in because what 69 hospitals did is they're funding the 10% difference between what the federal government reimburses Virginia for and the 10% when they go to 90. So the hospitals are funding it. So it's costing the taxpayer of Virginia zero, zilch. And you're only getting 30% of that back, but you guys are doing the right thing. This is why this was the biggest thing that you've done for working class people. This isn't like welfare for people that don't want to work or whatever AOC says. These are working class people working 2 and 3 jobs who are falling through the gaps between getting insurance that they can pay for and Obamacare, which they made too much money to get the subsidies. And now this is a bridge plan to help them out, of which Virginia hospitals are funding the gap. And nobody says this in the media. Nobody talks about this when they come on my show and rail against expanding Obamacare. And I'm just going on this rant, Sean, because we fought for this. We took a lot of heat over it. And the poll numbers now in Virginia prove us out. We did the absolute right thing. And for the Trump campaign, we're going to have to go back to these same voters that took advantage of this in 2020. And what were we going to tell them? Oh, sorry, we couldn't get your Medicaid expansion. Now you have to work 3 jobs? I mean, I'm so glad you guys did this, and thanks for stepping up.
Hey, and John, I got to tell you, it's sort of then this battle that we fought together is leading into the next battle, and this is this whole Medicare for all. With Medicaid expansion, with all the programs that came through, both existing and things that came through through the Affordable Care Act, through the Obamacare. Listen, there were a lot of things in that law that obviously we didn't support, and we continue to have challenges with, but it is the law. We've been living with it almost 10 years now. We have geared our programs and our infrastructures to meeting it. And we've ended up across the country, you're looking at 91, 92% of the people in this country have some sort of health insurance, some sort of coverage. And, this debate that's going on in Washington about Medicare for all, essentially, instead of focusing on that 8% of the people that don't have coverage, they want to blow up the 92% of those, the coverage for the 92% to go at the 8%. And, Medicare is a good program, and it has a lot of positive things, but the issue is that what we're scared about, you keep on hearing providers raise this, is that one of the ways the government saves money is by reimbursing healthcare providers at below costs. And so you're only getting between, 88, it's around 88 cents to the dollar. For every dollar of service you provide somebody, you get back 88 cents in reimbursement. Now, you make it up on, taking more commercial policies and people who are self-pay and whichever. And that's how you sort of make up the difference. But the issue is, under these Medicare for all, everyone will be paying or will be reimbursed at the 88 cents on the dollar, and they'll ban private insurance. And, we're very concerned about what's happening in Washington, how we've quickly sort of gone to this Medicare for all debate, and we've just barely have finally settled down on, the Affordable Care Act and implementing that. And we very much believe that people in Washington should focus on that 8% who don't have coverage. Don't blow up the health care coverage for the 92% that do.
And there's a bunch of Democratic candidates that want to make private health insurance illegal. So you're going to basically take health insurance away from over 200 million Americans. I mean, this is about the most insane thing if you really start to think about it. But the way you present it, it's like, why blow up a system where you're talking about 8% of people are not covered, not 100%. The other thing, and former Congressman Delaney brought this up in the debates, and of course the lying fake news legacy mainstream media wouldn't touch it, right? Because that's what they are. They're fake news. So that's why you have to tune me in every day, Sean. They wouldn't touch what Delaney said, which was, and I've had him on my show. Delaney said, look, I've talked to 50 CEOs in rural hospitals in America about this plan. And he said all 50, not 47, not 50 out of 50 said, under Bernie Sanders' plan, which everybody signed off on, Elizabeth Warren, etc., hospitals would have to take, according to his plan written in law, hospitals would have to take the Medicaid funding as it stands right now. Well, that is 88% of every dollar, just like you just said. So he said that every hospital CEO said within 12 months their hospital would go out of business because it would be financially insustainable if they had to take the Medicare fee, which is under cost. So nobody even talks about that, Sean.
Yeah, and you know, unfortunately, it is a very complicated industry, and you know, if we were to invent a healthcare system today, it would not be the system we have today. Mm-hmm. But we have a system that has evolved, and we have a system that, in many ways, has become so complicated that it sometimes works against itself internally. But we've got to keep on finding ways to improve it. You can't just simply blow it up and think you're going to end up with something better, because we have essentially, if you look back, 70 or 80 years and how this current healthcare system has evolved. And the thing is, John, it's not just about coverage. It is also one of the things that our poll focused on, and we asked various questions about, are they really mad at providers when we talk about people's frustration with healthcare? Are they talking about their doctors? Are they talking about the hospitals? Are they talking about pharmaceuticals? What are they really talking about? And it's fascinating. And you get this in the poll. People love their doctors. They love their healthcare systems. They are concerned about the costs of pharmaceuticals, and rightfully so. But, John, where the main frustration that comes out very clearly in this poll, and we are seeing it and hearing it every day, and we were hoping the politicians would start to listen to this, is that it has to do with what is happening with the insurance companies and the types of products that they're offering. And if you're somebody of limited means and you want to buy an insurance policy, and even if you're on the exchanges where you get a subsidy, here's your problem. I mean, if you're making an income that qualifies you for a subsidy, you do not have the financial wherewithal to pay a $6,000, $7,000, $8,000 deductible on some of these policies that are being sold. And so, yes, they're insured, but really they become catastrophic plans, because if you can't afford to pay for some of these policies and you get no subsidy, you don't have the financial wherewithal to buy a policy that has an $8,000 deductible, and you'll never ever meet it, because you'll never be able to put those type of out-of-pocket or copays into your health care. And I think this is some of the areas that people have got to start to look at, is what is happening, and some of these policies that we are seeing. By the way, John, we can see in Virginia, and from our numbers, that bad debt as a proportion of care and charity care and reimbursement in Virginia is continuing to go up. And we can directly point to people who are insured, but they can end up paying that $6,000 deductible to kick in the insurance that plan that they have. And I think these are things where they, forget about Medicare for all. Start looking at some of these plans. Start looking at, we think reinsurance that can potentially take these. If you really look, there's a small group of people, portion of the rest of the population that really drives a lot of our healthcare spending. How do you end up dealing with those people separately and doing some sort of catastrophic or reinsurance pool?
Well, these are national issues, Sean Connaughton, that transcend way beyond Virginia. Next week, I got to get you back on. We're out of time to talk about COPN, which once again the funders and donors are trying to get rid of, so they can basically be able to go into rural areas, cherry pick the most expensive services, cut the price on them, and drive rural hospitals out of business like they did in Virginia. And they're backed by the Cato Institute and other people that get money from the corporate interest that want to be able to cherry pick rural hospitals. So that's another battle that we don't have time for today, that drives me insane because I've already flushed it out, Sean. And so we're going to get you back on next week for that. Thank you, Sean. No fake news here. Sean Connaughton, President and CEO of VHHA. That's the Virginia Hospital and Healthcare Association. Sean, you and I were right in fighting this battle for Medicaid expansion in Virginia. Other states that are fighting it should do it as well. All the results are starting to come in now, and I want to commend you, Sean, for your leadership in making this happen. Thank you.
Hey, John, listen, great talking to you. And listen, I'm watching out for your health care, so don't eat too much up there, okay?
I'm just having this prosciutto that I also got the Italian meats and cheeses going, baby. Yes, Sean, I have put on a little bit of weight, but I'm not going to worry about that, Sean, right now, because if things don't work out, I can always go to a rural hospital in Virginia. John Fredericks Radio Network. Sean, thanks for being with us. I got to roll.
Take care.